Okay, this is like take 10, so this time I've decided that I'm not going to stop the camera. I'm just going to jump into the deep end and see what happens from here. My name is Elle, and this is my very first video blog, if you will, on my weight loss journey. First, I wanted to take the opportunity to thank all the other weight loss surgery patients who have taken the time to share in their journey, because I got so much inspiration and just I'm just in awe of the number of you that have put yourselves out there and shared your stories. And in particular, I wanted to thank Diva Tanya. You were such an inspiration, and what a great personality, and congratulations on your achievements. And I hope that the future just continues to bring good things for you. Just to tell you all a little bit about my story and the reason why I decided to do video posting is that in my research I found it very difficult to find other women in particular who have had a similar background to myself. And in that, what I'm going to specifically refer to is I'm a cancer survivor. At 38 years of age, I was diagnosed with triple negative breast cancer. And about a month or so after my diagnosis, I had a bilateral, meaning both sides, mastectomy done, and lost 13 lymph nodes, and went through 6 or so months of pretty nasty chemotherapy where I was in the hospital a couple times. I was so sick. And then I followed up with radiation, and then eventually I had reconstruction. And that's not what I'm here to talk about, though, although I'd be happy to answer any questions that you might have about that. I did have reconstructive surgery done, and that's been a really powerful healing tool for me in terms of feeling like I'm not sick anymore. But as a result of the chemotherapy that I had, and simply my body aging 10 years and 6 months, I've put on almost 60 pounds in just a little over a year. And I'm feeling really uncomfortable and just not happy with how I feel. It's not about a dress size for me. I've been a big person all my life, but I've also been a very active person. Last year I did my first triathlon. I just finished running a 5K for the breast cancer run here in Canada, and I have 3 really active kids. But the thoughts of going downhill skiing in January with them right now, it scares me because I'm going to hurt myself. I'm weighing in currently at about 270, give or take a couple of pounds. I have severe fluid retention in my legs and in my abdomen. At night, it's particularly uncomfortable. And so my family doctor and I decided that because I've given some other programs a try and nothing seems to have worked, that gastric bypass surgery would probably be my best bet. What can I tell you from there? It's been about a year since I had my first meeting with the specialists at the weight management clinic, and I was given a surgery date, and it's 3 weeks from this coming Monday. And I'm pretty excited, but I'm also really scared. It's fear of the unknown. It isn't a decision that I've made lightly. I have done quite a bit of research and investigation into complications and whatnot, especially for myself with the healing, because I did have radiation to the left side of my chest, and potentially in a few years down the road I could have some repercussions from that with my heart maybe and my left lung, from damage. Not to say that it's going to happen, but it's not out of the question. So I have done a fair bit of my research, as I said, into making this decision to go with gastric bypass surgery. The procedure that I will be having done is the Roux-en-Y gastric bypass. That's the best option for me, according to the specialists, and I do have faith in them. They didn't agree right away that they would even take me on as a patient until they did some pretty significant testing on looking if my stomach had been radiated at all, if my heart had been affected, so on and so forth. Sorry about that. If I just blanked out, I'm not sure if it did, but my screensaver came on. I'm going to have to learn a lot of new things with this, I think. What else can I tell you? I start my liquid diet on Monday. That I'm not so looking forward to. I do like to have dinner with my family every night. We do make that a priority, so that's going to be a little bit difficult, but my husband and I have both taken it on ourselves to educate the children as best as we can, so that they understand why mom's eating a little bit differently than they are. In the beginning, anyway, they understand that I will be eating the same things they will be later on down the road. Um, my goodness, I think that's all for now. I think I'll probably try to do an update or a secondary video later this week to let you know how the liquid diet is going. As I say, I'm not really looking forward to it. But I guess I'm allowed to have some chicken or beef broth, clear, low sodium broth. So that I think I'm going to look forward to maybe around dinner time. Um, but yeah, thanks for welcoming me to YouTube, and my screen name is KNADNA. That would happen to be a license plate that I had when my family lived in Virginia Beach for 3 years, many years ago, and it was Canadian, eh? I know, it's kind of sappy, but I am a proud Canadian. And yeah, thanks. Till next time. Cheers.